MK-3475 is an inhibitor of PD-1, and what ends up happening with this class of drugs, whether it is a PD-1 inhibitor or a PD-L1 inhibitor, is that it is blocking the interaction between PD-1 and PD-L1. That interaction basically inhibits T cell activation. T cells are a component of the immune system, and so to sort of overly simplify it, you are inhibiting an inhibitor of an immune response, and therefore you are presumably stimulating an immune response. This is a field that we've been very involved with, but nonetheless, I think that it is one that we still poorly understand, and in many respects, I think sometimes we get ahead of ourselves in being pushed to explain what we see when in reality there's a lot of learning we have left as a field to do about this. What we have seen, which has been extraordinarily exciting and has generated a lot of the enthusiasm, have been responses that so far have lasted for quite a period of time. So with MK-3475 specifically, there is extraordinarily little that is published to date. There are no publications about the effectiveness in lung cancer, and there really is largely one data set that's been presented at the World Lung Conference in Sydney, updated slightly at a meeting in San Diego this past January. What was shown as part of that was that the response rate was in the 20 to 25% range. There are some nuances about how one measures response, and so based on how you measure it, it can be a little bit different. The response rate, though, of 20 to 25%, although not as great as we would like, certainly was better than what would be anticipated in the group of patients we were looking at, which was patients who had had 2 prior lines of therapy. And I think that for many people, what has been more interesting than even the percentage of people who have responded is the duration of response. So the most updated data that has been presented on the duration of response shows that of those people who had a clinical response, who had significant shrinking of the tumor, we don't know how long the middle person stayed on drug because the last time it was updated, the follow-up was 62 weeks, and more than half the people had remained on drug. And that has certainly been an exciting finding. We typically, with our standard chemotherapies at least, have had great difficulty keeping people on a drug for that period of time with their disease not getting worse. And so I think it has led to a great deal of enthusiasm. You also asked about the PD-L1 expression. So this has been an area of a great deal of research. So as part of the MK-3475 trial, all patients needed to undergo a fresh biopsy. And so that biopsy has been evaluated for the level of PD-L1, with the idea being that the level of PD-L1 will predict whether or not an inhibitor of PD-1 or PD-L1 would be beneficial. Now, there are data sets that vary quite a bit based on agent, based on method of testing, and I think that this is an area that is certainly being evaluated. There have been a great number of people already accrued to the phase 1 study, and the phase 2/3 study is ongoing. The enrollment for the phase 2/3 study is that patients will have to have will have to have PD-L1 expression that is positive. Now, there are many questions about this. Do you have to be really positive, or does a little positive matter, or are there people who are negative who are doing well? And there certainly are reports